Hey everybody, thank you for joining me for another episode of PTDude's Ask a PT. I am Richie, and today I'd like to talk about the rotator cuff muscles. These muscles are often incorrectly called the rotary cuff muscles. The goals of this video are to learn what the rotator cuff muscles are, where they're located, what their function is, common injuries to the rotator cuff muscles, and the typical recovery from a rotator cuff muscle injury. This is a special announcement. These muscles are not, repeat, are not the rotary cuff muscles. They are the rotator cuff muscles.
Location.
The rotator cuff muscles are located in the shoulder. Oftentimes it will be your overhead athletes, your baseball players, swimmers, etc., and workers that work with their arms over their heads that injure these muscles. Alright, let's switch to anatomy vision so we can discuss the shoulder anatomy. Here we go! The rotator cuff muscle group is made up of 4 muscles in the shoulder. A mnemonic to remember the muscle is SITS. The first S stands for the supraspinatus, the I stands for the infraspinatus, the T stands for the teres minor, and the last S is the subscapularis. The overall goal of the rotator cuff is to provide shoulder stability by holding the humerus into the joint.
Function.
This right here is the supraspinatus. Its job is to assist in moving the arm into abduction, which is the arm moving to the side. This muscle right here is the infraspinatus, and its job is to assist in rotating the arm outwards, which is also known as external rotation. The teres minor, which is this muscle, assists in rotating the arm outwards and with bringing your arm back towards your body, which is external rotation and adduction, respectively. The last rotator cuff muscle is the subscapularis, which is on the front of your shoulder blade. Its job is to rotate the arm towards the body, which is called internal rotation, and to also move your arm back towards your body, which is adduction. The most common types of injuries with rotator cuff muscles, not in any particular order, are tears, tendinopathy, and tendinitis. A tendinopathy is a degeneration of a tendon, and a tendinitis is an inflammation of a tendon.
How it's injured.
So, how do the rotator cuff muscles generally get injured? Although there are many ways to injure these muscles, I will talk about 2 categories of injuries: acute injuries and degenerative injuries. Acute injuries are injuries that occur due to a single event. For the shoulder, the most common acute injury is a falling on an outstretched hand, which is also known as a Fuchs injury. Degenerative injuries are injuries that happen over time. Degeneration can occur from repetitive activities such as heavy lifting and overhead activities like throwing, swimming, hammering, etc. Sometimes a bone spur can develop, and with the combination of poor posture, it can cause shoulder impingement. A shoulder impingement is when the space in the shoulder that the rotator cuff muscles run through decreases. This is usually due to inflammation. When the space is narrowed, the acromion can rub against the rotator cuff tendons and cause irritation.
Recovery.
The goals of treatment for rotator cuff injuries are to manage the pain, restore the range of motion, the movement, strengthen the muscles in the upper back because they help stabilize the shoulder complex, and to improve the overall strengthening of the shoulders. If you see a surgeon and it is recommended that you have surgery, you can expect to be in therapy for a while, where a protocol will be followed. Generally, these protocols range from 3 to 4 months, but they can vary. There is no evidence of better results from surgery performed near the time of injury or later on. Therefore, a lot of times people will try the conservative treatment of physical therapy before surgery. Thank you for watching my video. I hope you enjoyed it. Please hit the subscribe button so you don't miss out on future videos.